wanted to say, to let you know that. We're also live streaming this. So a couple of things. We're live streaming this, and it's both on YouTube and on Facebook Live. Plus we're recording, and if people want to just take lessons learned from tonight and use it going forward, that would be great. But I just want to say to you two, thank you for being here. And I want to thank the Jim and Pam Deal Family Foundation for really making this happen and getting this in front of us. And just give you a little bit of information, folks who don't know me. I'm Senator John Hoffman, and we just got done debating a veterans bill done on the floor. And so now I'm here with my legislative assistant, Kevin Parker, and your beautiful downtown St. Paul. That's one of the hats I wear. The other hat I wear is I'm the executive director of Begin Anew Recovery. Begin Anew is a brand new recovery community organization in beautiful downtown Ramsey, Minnesota, in Anoka County. And it's a nonprofit that really benefits from using technology to maximize the potential of connecting. We do believe that connection is the opposite of addiction. And we engage with the community, we build awareness, and we educate people about the challenges that folks are facing with substance use and their families, right? And the support for families of individuals in recovery, we know, is severely lacking. And something that we specifically focus on improving in an enhanced recovery model. That's why we said it's time to do a new support model, right? You focus on some of those tracks where some assistance is needed. And with me tonight too is Kelly Waller, who's our operations manager, as far as, and Rhonda Schaefer-Smith as well as here on this call. And what we really wanted to do was to look at getting sustainable support in all these lanes: housing, education, environment. Here I'm talking like a legislator now. Education, education, and employment. One of the models we have, discovery employment. We come from a Griffin-Hammis model of employment discovery, which doesn't focus on filling out job applications, but really looks at themes of employment. That's a new model. That's what we're bringing. And the other thing is the financial education piece, our partnership with Financial Education of Minnesota, really the Pay, Save, Spend rule. If anybody wants to go ahead and Google the Pay, Save, Spend rule, Kent Johnson, who helped write that book, is a curriculum that we use. The other thing that delineates us, Carol and David, is that the technology, right? We know that people are living in this lifestyle, and it's like, why pick up the phone, the 500-pound gorilla, and make phone calls when if I'm really actively tracking? And that's where Pathfinder comes into play and comes into really big. And as we look at that, we're saying that those are some new things to looking at recovery in Minnesota. But enough about me and enough about Begin Anew. And really, folks, thank you for being here. Carol, right now there are 20 people and there's more coming on, right? You have the Carol McDaid, folks, serves as the principal at Capital Decisions as a special expertise in addiction and mental health policy, right? For over 2 decades, Carol has worked with leading drug and alcohol treatment folks, addiction physicians, prevention and consumer organizations, as well as the mental health consumer and provider organizations to really refine what public policy is addressing addiction and mental health. What we get with Carol, folks, is 25 years of federal legislative experience, right? And starting really in Washington, D.C., where she provides that public affairs consulting on issues, and it spans the breadth of healthcare, including behavioral health, Medicare, Medicaid, and the private sector. One of the things that you did really well was the influential in the passage of the 2008 Paul Wellstone and Pete Domenici Mental Health Parity and Addiction Equity Act, right? That's landmark legislation, and that requires that insurers treat addiction, mental, and physical health problems equally. And that's really what we're here today to talk about. And the other thing you did in 2004 is, with your husband, you co-founded the McSheen Foundation in Richmond, Virginia. And that's a leading nonprofit full-service recovery community organization. So happy that you're here, right?
Thank you. Glad to be here.
It's great. And one of the things that I got to put in here, As I worked at the Frank Porter Graham Early Childhood Development Institute at the University of North Carolina, y'all comes down there, and you're a North Carolina native, Carol.
I sure am.
Even though you left and went to Atlanta, Georgia, where you got your degree. And folks, also with us is David Wellstone. David, I've known for many, many years. Nation's leading advocate on mental health and addiction issues, including working with Carol on securing the passage of the Paul Wellstone and Pete Domenici Mental Health Parity and Addiction Equity Act. Building on this, David, your latest work and the lessons learned in operating a sizable sober housing business in Minnesota, you co-founded with Joe Morris and Rick Kahn, a public benefit corporation called Pathfinder Solutions, and that's really that key. That's a real change maker, right? As the son of Senator Paul Wellstone, who I don't know if you guys see behind me, but that's signed my daughter, a picture of my daughter. That has been with me since prior to my first election in 2012. And it's the sign that my daughter put flags out in front of. And David, this is where your dad, a friend of mine took that sign and he framed it. And the day I was sworn in 2012, he brought it to my Senate office, which was in the Capitol. And it's always the first thing on the wall and the last thing I take down. So that's with me. And so the, that mental health parity piece that your father was so much a big part of his life, right? And he worked across the aisle, David. His work with Jim Ramstad, or the Rammer, as we would call him, really kind of lay that playing ground for what people should understand about, well, what is this thing called mental health? What is this thing called parity, right? And you said, I remember in an article, that in this political, very polarized atmosphere we're in, you love to work on these issues that bring people together. Mm-hmm. And you said, David, it doesn't matter whether you're rich or poor, none of that matters. The fact is you got to work on this together. That's what Rammer and your dad always talked about. Doesn't matter, put your ego in the hallway. The other thing, the Mental Health Parity and Addiction Act that you worked on was signed into law in 2008. You two required that insurance companies start to cover addiction and mental health treatment, right? Your father had been working over a decade to get that law passed, but it took you another 4 years after your dad had left us to get that done. And so the other thing you said, David, and folks, you need to know this, David said, we're paying more attention and we need to. Think about that key statement that David Wellstone said. We're paying more attention and we need to. With respect to this mental health parity bill, I think a lot of people don't know that there's this civil right out there, right? They don't know if they're denied care for mental health or addiction that they've got recourse, right? So that's going to tell us, going to lead us into the conversations that we want Carol and David to get us into, is what's next for us, right? We want to know lessons learned, but what's next, right? And so, it was an eye opener, David, for what you did and what you and Carol did. And so, folks, what we're really here is the Mental Health Parity Act provided that large group health plans cannot impose annual or lifetime dollar limits on mental health benefits that are less favorable than any such limits imposed on medical or surgical benefits. Think of that typical politician word, less favorable, right? But what it does is it adds those significant new protections, right? And it requires the general equivalence, right, in the way of mental health and substance use disorder, that medical and surgical benefits are treated with respect to the annual and lifetime dollar limits, right? I mean, that was the piece that was in there. And so what I guess I really want us to really start off with, David, is, talk about this. What were the lessons learned? How did you get people to understand? Because one of the things that we always hear from folks and advocates is like, nobody's listening to me, right? We're all operating in these silos. We're not thinking intersectionality. We're not thinking about integration. So why don't you introduce, if I forgot anything in my introduced bios to you, but welcome, David. It's so good to see you here.
Yeah, thanks a lot, John, and appreciate everybody coming in here. I know Carol is going to get into the nuts and bolts, right, of what Parity did. I think you hit it right on the nail, right, John? You can't use different measures for a physical illness as you can for a mental illness or SUD, and there's a lot more to be done. People don't know that they have this right. We have to do a lot more with respect to enforcement. Carol's going to talk about that. So what I want to do is lay out a little bit of the story to hopefully give some inspiration, because I think inspiration, never giving up and knowing that you're on the right side is a critical thing. And I think most of the people here are fighting the good fight and don't always get recognized for that. And then Carol, let's let you get into the guts, I think, of stuff and what we can all do together here, together moving forward, because there's a lot of stuff to do. So I'm going to start with this. My dad's passion, a lot of issues he worked on, but mental illness and addiction was his top issue amongst all the other issues that he was known for. He grew up watching his brother, who had a mental illness and was put into a home. When my dad was 12, 13 years old, he used to get on a bus and he would go out to this mental institution that he called the snake pit and see the way people were treated. And he always swore if he was in a place to do something more, he would. So he had fought, like you said, for years, I think 12 years prior to his death, to get this mental health parity bill passed that he had introduced. I'm going to start you all with a small story, and it's from the memorial service for me, where this started. Lost my mom and my dad and my sister in this plane crash. I was at a memorial service, pretty much in shock. I had gotten to the site of the crash, watched the plane burning. I saw figures in that plane, later struggled, my own struggles like most of us have had, but PTSD was one of the large ones I had. So I came into this memorial service pretty shell-shocked, with thousands and thousands of people in Williams Arena, gave a speech, went into the back room, and I met the President of the United States, and half of the US Senate was there. It was President Clinton at the time, and they all shook my hand and they looked me in the eye and they said, "We're so sorry for your loss. Your father worked hard on this mental health parity bill. It was his signature bill. We are going to pass it in his name." And I looked at everybody and I thought, that's great. I thought that would happen. It was one of the lessons I learned, John, in politics. Because later, so I moved to California to start a new life, tried to start over. I'm Paul Jr. I see my name, Paul Wellstone, runs together there with a small P. That just goes to show you my actual tech acumen. I don't know how to get that fixed. So I moved out to California to try to start over. And while I was there raising kids, I got a call. And the call was from a woman by the name of Ellen Garrity, who was my father's healthcare person, right? And worked on the parity bill. And she said, "Dave, there's a bill being introduced. It's a parity bill. It's being introduced by a Democrat, Senator Kennedy. But it's a bill in name only. And it's a bill that your dad would roll over in his grave if it was passed. And they're trying to name it after him." I would like to say it reawoke me. I was depressed, struggling, doing my thing, and I was just pissed. I was like, how could this happen? How could people look at me at the biggest time of, sorrow and make these promises and not follow through? That got me re-engaged in life. I like to say it's why I do what I do now. I didn't choose to work on these issues necessarily. These issues chose me. My path was chosen. Whatever you believe, I do believe in a higher power. I believe in something bigger than us. And I'll tell a little bit about how I got there. But so it's when I met Carol McDaid, got involved, worked hard. We worked hard to first fight back that first bill, the original bill that Senator Kennedy had put forth, and then and his son, Patrick Kennedy, and Jim Ramstad, as John called the Rammer, introduced sort of the original Wellstone bill, as it were, the one that my father had worked on for so long. And so I could tell you all kinds of stories. I'm going to tell you just a couple of them, because what I want to talk about again is perseverance. And I think I have this belief that if you're fighting the good fight, if you're fighting for people, if you're putting your integrity and people over profits, those kinds of things, that good things will follow and you can make things happen. We were very underfinanced and we were fighting a heavily financed bunch against us who did not want to open up these things, health plans, drug companies, all kinds of folks. But I think one of the things I want to talk about is by always staying the course and believing and not giving up, you can make amazing things happen on a big level, on a small level, but they're all critical things, right? No matter where it is, it's a microcosm. Most of you folks are working in your communities, and those things you're doing in your communities are critical. And I'm sure at times you feel pushback and you feel somewhat defeated and you feel, can I get there? And part of what I want to say is you can. So in that parity fight, there were times over this 2-year period when we thought it was over. We had Patrick Kennedy, who talks in his book publicly about the struggles and relapse at that time, struggling during this time. Carol and I went in to meet Jim Ramstad at one point when we thought the bill was dead, and he wouldn't open the office door because we were so on fire. And he just thought, oh my goodness, I can't see these folks. But we went in there and we said, we've got to drive on. We can't be beat back. Now, what was happening is we had built up bipartisan support. As you know, this isn't a Democrat or Republican issue. This is an issue that affects people. We had support from both sides of the aisle. But what was happening at this time is the bailout bill. I don't know who remembers it, the TARP bill that saved the banks and all that was going on started to take up all the oxygen in the room. And another lesson I learned the first time when my dad tried to pass parity, they ran out of time. It wasn't that they ran out of votes or that people wanted to oppose it, but a strategy, or sometimes things happen, you run out of time. It looked like we were going to run out of time on this bill after years of work. We were down. I went outside one day, outside my father's former office. And Carol, you weren't with me, but I remember sitting out there and I looked up in the sky and it was a calm but hot day in DC, as it often is. And I looked up and I said, Dad, if you can hear, if there's anything we can do. And I don't really didn't pray much. I wasn't raised in any religious format, so prayer was kind of foreign to me, but I said this prayer, and I'll be darned, the trees started whipping, the wind blew, the leaves went everywhere. I got the chills. Still believe to this day there was something spiritual. I got this feeling of, oh my God, we can move on, we can go. We kept pushing ahead, and I got a call from Harry Reid, who was this then Senate Majority Leader, called me into the office. Carol, you're going to remember this because this hurt a lot of feelings, actually. We had a team. And so Harry Reid said, the bailout bill is going to go. The only way parity gets heard is if we attach this massive $1 billion bailout bill to the mental health parity bill, which has all this bipartisan support. But you have to swear to secrecy. You can't tell even your closest friends, even the colleagues that you've worked with, because if it gets out, this bill is done, we wouldn't have this civil rights bill right now for people. Carol and I were there. We kept it quiet. Harry Reid, Senator Reid, introduced the bailout. And you should look this up because it's pretty intense and most people don't know this story. The bailout got attached to a parity, and then they started it through, then they split it off, and then parity became law, and there was the civil rights bill. I will just say the work is now just beginning, really, right? Carol, we put in all this time, but there's stuff, and Carol's going to talk about this next, but I'm really excited for this next stage to work with everybody here on what we can do to make sure people understand the rights they have, and to make sure we put teeth into this and that there's real enforcement so that we can help people that are struggling. You know, we worked hard to get the bill passed. A lot of you are involved with that too. A lot of work to be done. I'm excited to hear, Carol, because you're the expert on the ins and outs and what we can do now. But I'm just telling everybody, I'm looking at some names. I know some of them up there, really excited to connect together on this battle so that we can really bring this, you know, let people have the right that they deserve, and have some enforcement and teeth behind it. So that's the story that I wanted to tell, John. And I wanted to just, again, say, you could be down, you can be out, you can think it's not going to happen. But if you're fighting for people and you're fighting for what you believe in, I truly believe you won't be stopped. So sorry, I didn't have anything planned. It might have been all over the place. I shot from the hip there, but really looking forward to working with all of you, because you're on the grassroots, you're in the trenches, you're boots on the ground and doing the really important work. Thank you, everybody who's here, for all the work you do.
David, I really want to thank you for bringing us that bit of the history, right? And there's a couple of things that really, I think, resonate. Number one is you want teeth and you want enforcement, right? That's that accountability side, right? But the second thing that really shot me out is, the adage, never give up, right? Never give up, never give up. You guys never gave up. And the kicker for me within that second part is, we always hear the thing about finding a different vehicle. You ever heard that statement, right? Mm-hmm. And I had no idea that your dad's bill was trapped onto the bailout. They found somebody inside baseball, found another vehicle to attach it to say, here we go. So, I mean, never give up. Always look for different vehicles, right? A lot of times people get stuck saying, oh, it's in this jurisdiction and then I got to keep it in here. It's like, no, right? So lesson learned on that. So David, thank you very much for that history lesson for us. And Carol, what do you think? I mean, you got some slides you want to go through and chat with us, and as you're thinking back on the system, right? What was it that we finally get it? What were those things that knocked in there? And so
I think before I start the slides, I just want to add a little bit more context. Especially, I also know some of the advocates who are online with us tonight, and you've got a wealth of great, I know I saw Randy Anderson's name on here and others who are really effective advocates. But I wanted to share with you, so I started working on Parity in 1996. And, some of the important lessons that I think that I learned, it was initially Betty Ford and Rosalind Carter appeared together at the National Press Club in Washington to talk about parity in 1995. I learned an important lesson there, that keep the issue bipartisan to be successful. And even in this time where virtually nothing is purple, we've worked really hard, not red, not blue, but keep the issue bipartisan. The other thing is that as a tool for advocates, is to have great situational awareness. Timing really matters sometimes. And one of the observations, and of course, hindsight's always 20/20, but this issue was a lot about fathers and sons. And the reason why I had Ellen Garrity, Paul Wellstone's, crack Health LA, why I called her and asked her to call Dave, was because I too was having one of those moments that I need a miracle here. What can I do different? The insurers and the employer groups have us outgunned, outmanned, outfinanced. Who can I bring to the table that can get above all of that and appeal? There had been many days in the Senate where senators, not only Senator Wellstone, but Senator Gordon Smith, a Republican, Senator Harry Reid, had all talked about their family experiences with this illness. And there were some real watershed moments on the Senate floor that elevated the issue. And I thought, how can I keep that emotional appeal that was going on that day when these senators, one by one, came to the floor to tell never heard before stories about their experiences with their family members, or in Jim Ramstad's case, with his own personal recovery. And back in the 90s, it was just not cool, and it was not done that you talked about your recovery publicly. And a lot of times when I would be visiting on various issues, staffers would actually whisper about, oh, I've got a brother-in-law who's got a problem. And they would start whispering. And so, you have to kind of take stock of the awareness of what is elevating an issue. And in this sense, I thought that engaging one of Paul Wellstone's son could be the key to my success in the Senate, because, Paul was well liked by Republicans and Democrats. He wasn't just a friend. Back then there was collegiality across the aisle. And one of the great things in hindsight I've seen was that Dave, was still going through it from having lost, half of his family. And this issue was, I don't know if people are familiar with that children's book called The Velveteen Rabbit, that the toys in a kid's room come to life when they're loved. I watched Dave come to life when this issue gave him purpose again. And I'm honored to be able to say that. I haven't really said that to Dave before, but you could see, and he traveled. Remember, he's been traumatized now from seeing his family die on an airplane. And I'm asking him to commute every week from California to Washington to lobby on this issue. And we could get into offices and meet with senators better with Dave, with requesting the appointment for Dave. And then every time he would visit, especially with some of the female senators, they would look at him and embrace him and start crying. I mean, it was very emotional for him. So this was not a small cost for him to do this. The other father and son I was dealing with on the House side, in particular, was Patrick Kennedy and Senator Ted Kennedy. And anybody who's read his book, Patrick had daddy issues, right? He was never felt good enough compared to his dad, that he didn't measure up and that kind of thing. And here we had legislation where the Senate version was by his father, which his father had brought all the insurers and the employers into the table to work together, which, usually to build a coalition is smart, but not when you let the fox come into the hen house and water the whole bill down, as Ted had done. And so with Jim Ramstad's help, who at this point, or shortly thereafter, was sponsoring Patrick in a 12-step program, we were able to kind of talk to Patrick, because he had had his own experiences with trying to access care and how insurance wasn't covering it. And we helped kind of grow in him this sense of outrage that your father's bill is so much weaker, right? And so it was kind of interesting that, and I've even got out of Patrick's book, he talks about how Dave Wellstone had written in and told the senators, do not put my father's name on the Senate bill. It is too weak. He would roll over in his grave. It doesn't accomplish what real people need to be accomplished. It doesn't work on access to care issues. It's strictly on copays, deductibles, but then the plans we'll talk a little bit more about this, but they can crack down by using other kinds of medical management criteria to keep you out of the care that your health insurance premiums are paying for. So it was a lot in the past about understanding and being sensitive to your emotional surroundings and the activities of the day that can help lift your issue and elevate it. And so that's kind of one thing that I want to bring. I also had, my own personal recovery, my own experience about how right at a time when I needed help, I couldn't access it. I worked for one of the largest accounting firms at the time in the country, and they weren't even aware that this Cadillac plan that they had did not cover residential addiction treatment. I was fortunate enough to have a family pay for it out of pocket for me, but most Americans don't have that luxury. And so I was also inspired by my own sense of outrage and my own sense as a recovering person that I am to help those who come behind me. And so with all that, Kevin, if you'll humor me to start my slides, I want to talk a little bit about the substance of the issue and why we are still talking about this issue so many decades later. Thank you. Next slide. So mental health parity, what's it all about? What's it mean? So insurance coverage for mental health and substance use should be no more restrictive than coverage for Medicare. That's basically the long and the short of it. Also know that this is a civil rights issue. This is the next chapter in civil rights law in this country, and it won't be the only one. Looks like we're going to be having another debate about female reproductive rights as well in this country. But this was, at the time, it was a new chapter in civil rights. And so as you think about, well, where do I get the juice, Carol? Where do I keep going when the health commissioner or the insurance commissioner in the state of Minnesota refuses to hold health plans who are not compliant with this law accountable? You have to tap into your own sense of personal outrage. There's nothing wrong about channeling a little anger to juice up your advocacy efforts. Your personal experience, the experience of your families, you bring all that in to give yourself the perseverance that Dave talked about to keep going, right? And the federal law, as it was enacted in 2008, and then all of the regulations, because remember, when you enact a federal law, it's not like benefits start pouring out of a spigot that you can turn on. You have to pass regulations to implement the law. And since we had so many big stakeholders that were unhappy, even though they said they supported the bill, they did not want to support the version that actually passed, that really started to tear at their secret sauce of how they manage cost, which was to put all these like medical necessity criteria, and you have to fail first at outpatient 2 times before you're eligible for any residential or inpatient care. All these little techniques that they use to keep people out of care, those needed to be a part of the parity law. And that was the biggest difference between the Senate and the House version of the bill, that was really more in the spirit of Paul Wellstone, was that we didn't just talk about the financial equality, that you had to have the same copays and the same deductibles and the same annual and lifetime limits, but that also it had to be parity in the way you managed the benefit. And they never had that many. Yes, there's medical necessity criteria on regular healthcare benefits, but the trick is they were not applied as aggressively as they were. And so, you know, number one is you have to be an advocate on this kind of thing. You do have to have your homework, and you have to understand that this law is about comparing what happens on the medical and the behavioral health, or the addiction and mental health side. I hate that term, behavioral health. That was coined by the insurers, by the way.
Randy
Because
just gave you a thumbs up, which will at the end, Carol, hopefully I'll open this up for more dialogue between everybody here, but I just
sure, but the insurers came up with behavior so that they could act like it was the fault of the person with the illness, that you just had bad behavior. And it goes exactly the opposite of this being a brain illness, right? Okay, so parity passes, and it applies to most healthcare plans except for Medicare. And one of the real groundbreaking things about this law was all the state parity laws, most of them in the country, they didn't have the medical management requirement. The parity had to be in, the medical management techniques couldn't be enforced any more stringently on addiction and mental health, but also that employer plans, these large employer plans, could not be opted out of this, this covered those plans. And they had been very successful in state laws at carving themselves out. And this applied to them too, which, as you know, almost 70% of Americans get their health insurance through an employer-based plan. So many of the states, by carving them out, were basically cutting half the people that would benefit from it out of having access to this right. So next slide. So what does parity cover? It talks about which conditions are covered. It talks about what a mental health and substance use disorder benefits are. It covers, as I mentioned, copays, coinsurance, and deductibles. Let me give you an example of what I mean here. Before this law passed, it would be very common that if you wanted to go see a primary care doc or even a specialist, you'd have a $20 copay, or maybe if it was a specialist, it might be a $50 copay if you didn't have great insurance. But when you went to try to access a mental health or addiction counselor, it would be 50% of the cost of the visit, right? And so instead of paying a $20 or $50 copay, you were being asked, if your psychiatrist cost $160, you were being asked to pay $80. So it was this wide variation in what you as a consumer, your out-of-pocket costs were. And because many people with these conditions are not exactly rolling in dough, right? This would be a real deterrent from them accessing care. It also said that you couldn't limit, you couldn't limit, okay, you can have 20 visits of physical therapy, but you can only have 5 visits of outpatient mental health counseling. So all those inpatient days and visit limits and all that, they had to be the same. Okay. And then this fourth one, even though it's enough to make your eyes roll back in your head, but they're managed care practices, which in this law are called non-quantitative treatment limitations. that cover things like prior authorization, how they set reimbursement rates, their network adequacy. All these were other ways that they kept people out of care, but they were not copays, coinsurance, and deductibles. And what we found when the law first passed and the regulations first got enacted, what's the first thing the insurers did? Well, they knew they couldn't wiggle out of having different copays, coinsurance, and deductibles. So then they really cracked down on the NQTLs, these non-quantitative treatment limits. So all of a sudden, it wasn't medically necessary for anybody to go to residential treatment. You'd be limited. They'd say it's, we'd have to prior authorize your outpatient care to see if you really needed it. So as soon as we basically cleaned up one obstacle, they would go and like it was like whack-a-mole, watching the insurers come up with different ways to access care. And meanwhile, let's put this in context. Behavioral health benefits at the time, addiction and mental health benefits, were less than 2% of the total premium spend. So they're sitting there spending all this time, effort, energy, and money to crack down on what was less than 2% of their spend. So you couldn't help but seeing that they were stigmatizing these illnesses and those people that had them. There was no other explanation for it. It financially didn't even make sense. So the other thing that the law does is it tells you what they are required to give you and how and what the timeline is for that. So if they tell you your care is not medically necessary, they have to give that to you upon request what their plan's medical necessity criteria is. And so these are the kinds of things that the law provides. Next slide. Yeah, so why are we still talking about this 10 years later? Well, in short, it's because the law has not lived up to Paul Wellstone's vision. It just hasn't. And let me explain to you why. And this isn't about excuses of a lobbyist who hasn't done her job right. This is just straight factual thing about the law. So the federal parity law, the jurisdiction about whose job it is to enforce it, is split between three different parties. Three are federal, and one is state. So, and it's all based on you as a consumer knowing what type of plan you have to know who you go to complain if your benefits are being denied in a way that you think is unlawful. So what do I mean by that? Well, if you have a health plan that's provided by like Blue Cross or Cigna or Aetna, you have a fully insured plan. And for that, you go and complain to your state insurance commissioner or whoever in your state is in charge of dealing with health insurance. Some people, it's called the Corporation Commission. Most states, it's a state insurance commissioner. If you have a self-funded or a large employer plan where they pay for their benefits themselves, then you go to the Department of Labor. If you are in a Medicaid managed care plan, you go to a Division of Health and Human Services and complain to CMS, the Center for Medicare and Medicaid Services. So number one, that requires consumers to know what type of plan they have, which is often really confusing and not very clear, especially if a large employer hires a third-party administrator to manage the benefits for them. It looks like you have a fully insured plan. So that was cumbersome to implement because each of these agencies had to have their own enforcement mechanisms. Okay, and the other thing about it is the law is complicated and it requires a level of healthcare and addiction and mental health care literacy that most Americans don't have. And so the other thing about that has been difficult, the way the law has been implemented, it puts the onus on consumers to complain instead of the onus back, on my view, on the federal government and state government to make sure a federal law is being complied with, because they are required to implement federal law. And I think we're still talking about it because numerous reports have found that state and federal investigations have found that insurers and health plans are not fully compliant with the law. We just had the latest one in March of 22. I've got a slide about that later, but it was just devastating to see that this later how non-compliant things are. We also found that the rates of mental health and addiction were bad before COVID, but have gotten steadily worse post-COVID, okay? So we're still talking about this because basically insurers in this country are cost shifting what they ought to be paying for in coverage of addiction and mental health services, and they're cost shifting it back to states, and they're drawing down federal substance use and mental health block grant dollars and Medicaid dollars on benefits that they should be paying for people. And then people who are employed, if they're untreated addiction, sometimes they'll end up getting fired. Then they go on the Medicaid rolls, and then it's coming out of our pockets as taxpayers. So there's a basic unfairness here. And I might add that all during COVID and after, they have double-digit profit rates. You can go on to any open call with insurance companies when their investors are on, and they will brag mercilessly about how their profits have been 10%, 15%, 20%. And this has been routine, folks. This is not just COVID. This is routinely, they've been making these kinds of profits and then nickel diming on the backs of Americans and their families with addiction and mental illness, not to pay for something that's less than 2% of the premiums that they have. State and federal regulators have been slow to implement. I think we're still talking about it because this is a fundamental civil rights of Americans, and communities are being devastated unnecessarily by untreated addiction. Mental health, suicide rates are skyrocketing, overdose rates are skyrocketing. It's immoral during this kind of a period in our country's history that they're still not paying for access to care and are flaunting a federal law that they're required to comply with. I actually had a plan lawyer tell me the other day, Carol, this is the most complicated law. We're just not sure how to implement it. And this is, this is 14 years after they've been required to comply with it. And so the other part of it is it's complicated. And this has been part of the reason why it's been hard to enforce. And then, as I said, it puts the law, you'll hear this law also called the Parity law. You'll hear it called MAPEA. You'll hear it called Mental Health Parity Addiction Equity Act. You'll hear it called the Wellstone bill. So all of those things are referring to the same bill. Next slide. So just to show you how bad compliance rates are, and I'm not going to read this whole slide, but one of the things that advocates do is we gather data to show when laws are not being complied with to be able to prove it. And so we hired an actuarial firm, Milliman, that's, highly, looked up to in Washington. And we had them study, the out-of-network disparities between behavioral and mental, and between medical and mental health and addiction. And basically over this period from 2013 to 2017, people are 540% more likely to have disparity between the cost of their mental health or addiction visit and their medical visit. In 2017, when you look at reimbursement rates, and there's been a lot made in our field lately that we have this horrible behavioral health workforce problem. The reason why we have inadequate networks of providers in our state is because there's just this huge workforce shortage. Well, let me tell you, folks, insurers are not dumb. When they have a shortage of dermatologists or oncologists, guess what they do? They increase their reimbursement rates to bring more practitioners into their networks. What have they done with addiction and mental health? They've kept reimbursement rates unbelievably low. Okay, so in 11 states, reimbursement rates for primary care office visits were more than 50% higher than reimbursement rates for addiction and mental health office visits. It's unbelievable. And then when you looked at, out of network care, and why do we care about out of network? because that means that you as a consumer are having to pull more money out of your pocket to pay for the visit. And so I don't know if any of you have had the unfortunate thing of trying to find a psychiatrist that's in network in your health plan, if you have health plan covered, but they're far and few between. And half the time when you call, they'll tell you, oh, I haven't been in that network for 5 years. We call those phantom networks. Well, all of these things, if you encounter them, you have to complain. They're counting on that you will not complain. And so one of the part of my work over the last 10 years on this has been teaching people how to complain about what your rights are and how to complain. Because remember, insurers operate on contracts in all 50 states and territories. And they're at contract time, which is usually every 3 years when a state decides whether to re-up and let this insurer sell health insurance in their state. One of the things they look at is the number of complaints. And what state officials do is they pull out those complaint numbers and they go, well, Cigna, God, you had, 2,500 complaints in this last 3-year contract period. What is happening here? We need you to do a little better. And oftentimes they can even lose a contract if there's complaints. So silence kills us, folks, not only about the illness, but about this law. Silence about your experience working and struggling, trying to pay for these benefits. If you stay silent about it, nothing changes. And this law, because the way it's crafted, unfortunately, it is complaint driven before federal and state officials will act. So out-of-pocket costs for consumers are higher. Reimbursement rates for our providers are lower. And the fact that the networks are less generous on our side. So these are all problems showing that compliance not only is bad, but it's gotten worse after the law passed. Next slide. So let's talk about what are the feds? What are we in Washington doing to enforce this law? Next slide. So we've had a series of regulations, and I've told you regulations, it sounds really gobbledygooky Washington stuff, but there are states too, and you have to operationalize a law once it passes. And so what we have done is we have gotten a series of different regulations passed. Then when the health plans were still flouting and boldly not complying with them, then we went back to Congress to say the regulations are not being honored. We need you to put in more legislation because these poor health plans that have a battalion of lawyers just can't seem to figure out this law. And that was their complaint to the federal agencies that implemented it and to Congress. It's just so complicated. We just can't figure it out. Now, remember, this is the same lawyers that design pension plans and all kinds of other plans, welfare plans, but they just can't seem to figure this out. They figured out the Affordable Care Act, but they just can't seem to do this. And, it's straight stigma. And, stigma is illegal now with this law. You just can't. Stigma in health insurance is no longer legal. So it's our job now to hold them accountable. And so we would keep going back. So the regulations would get issued. Then we would show that, they would come up with things like, well, you can't go to treatment outside your state. Well, you can go to the Mayo Clinic if you've got cancer. Why can't you go to Hazel and Betty Ford if you've got addiction problems? So then we would get that loophole closed, and then we'd have to go to the next one. And the next one was this stuff about having to fail at outpatient twice before you're eligible. And not only that, they would start the clock over if you missed one outpatient visit. And I don't know if your addiction showed up in your life like it did in mine, but I was not exactly like meeting all of my commitments and making every appointment. So what I found out is even though I'd gone through 2 rounds of outpatient, because I missed one meeting, one outpatient visit, they'd start that clock all over again. So then we got things like that outlawed. And then we got their loopholes. They weren't allowing people to be on medication assisted treatment. They were putting all these extra, paperwork burdens on providers who wanted to prescribe MAT. We get those shut down. But it would be like this endless game of whack-a-mole. We'd shut one loophole down, then they'd go on another. And this has been going on for decades now. I mean, we're more than a decade. So then we also got things that we found like, okay, we get residential addiction treatment straight. Then they crack down, you can't go to eating disorder. You can't get eating disorder help. So then we'd straighten that one out. So this went on a while until we started going back to Congress and going, they're laughing in your face. They're not complying with this law. They say they don't understand it. Give them more guidance. So in 2018 and 2019, we got more guidance coming out about exactly how plans have to show how they've compared, what that analysis is like between physical and mental health. Next slide. So then we went and got a GAO report done. GAO stands for the Government Accountability Office. They're sort of like the watchdog agency of Congress. We got that included in the 21st Century Cures Act. They continued to show that in particular, they've straightened out the financial requirements like copays, deductibles, because there's not much wiggle room there. But what this report showed that they continued to hammer down on the non-quantitative treatment limitations like medical necessity criteria, prior authorization, concurrent review. Like if you had a medical disease, like let's say you were going for a hip replacement, there is a set number of days which you were authorized to get into the hospital. But if you went into a psychiatric hospital, they'd be asked every day, the insurance company, you'd have to call and get another day authorized. So there was a whole different schema that was being used for medical conditions versus psychiatric conditions. And so all of these kinds of things were discovered in this report. And then, the federal government was acting also confused about what they needed to do to fully enforce this, because one of my faults with the federal agencies, they never gave specific guidance to the states on how to implement this law in your state. They held 3 phone calls in 12 years with states on how to implement this law, and they never gave them written guidance. And so, of course, we've gotten a mishmash, and we even have 4 states that say they will not implement this law, and the federal government has had to take over in those 4 states. Montana is one of them. Next slide. But for you advocates out there, when you are finding you have well-funded opposition who are basically, I don't know how to say this nicely, making up stories. Oh, they go up to the Hill and they tell everybody we are in complete compliance with the law. And then we would have to come and show them claims and go through the whole thing. This, got overturned on appeal, blah, blah, blah. You go to your watchdog agency and start there sometimes as a way to get the truth being told. So I'm sure you have such a watchdog agency in Minnesota for you Minnesota advocates. And this might be a place where you get a level playing field about what the truth is about parity compliance in your state. And maybe also what your state insurance commissioner is doing to enforce this law. And a watchdog agency report is oftentimes a good place to get your effort renewed and reinvigorated, because once that data comes out, then based on those recommendations, you can introduce legislation, you can devise new regulations, but you've got the level set of what that watchdog agency, which everybody has to listen to, as a evidence base for the work that you're going to do after that. In the last legislation that we got, there was surprise medical billing legislation. And as Senator Hoffman said, oftentimes you have to look for vehicles to get your stuff in. We knew the surprise medical billing, this is like if you've had a hospital stay, you thought it was covered and you find out that, it wasn't covered, that kind of stuff. We knew that was very popular, had bipartisan support. So we got a parity title embedded in there, and it moved quickly because they were trying to get in front of all the groups that would oppose it. what we got here done, we thought, okay, we've tried everything here. We've sued, and there's still lawsuits pending, a ton of them. We've complained to Congress. We've got new language. We've got new regulations. Let's try shame, okay? And I know shame-based is sort of a dirty word in the mental health field, but we thought, let's have the secretary send them a letter saying them you're out of compliance. You have 40 days to submit a plan, a corrective plan of action. And if you hadn't done that, after you've said, and we go back and check, and you've not acted upon the corrective action plan, we're going to notify all your policyholders that within 7 days that you're out of compliance with the mental health parity law. And what we have found, as usual, is that they are running the clock out. And so they'll get to the 44th day and then start the clock all over. But we still think this can be a powerful tool once we nail down that they can't game. We've already got legislation in bills, which I'm going to talk about. But we have to continue, and this is why I'm so big on y'all teaching people how to report. I mean, even if in your signature line on your emails, if you said, feel like you're not getting the mental health and addiction coverage you deserve, call this number and have it be the complaint line at your insurance or commissioner's office. That was a strategy used in New York that really, really helped them move the ball down the field on parity and got huge fines imposed on the insurers that they were getting all the complaints about. Next slide. So, as I mentioned, we had a recent report, and the Department of Labor, who again is responsible, who's got the largest amount of jurisdiction to enforce this law. They sent this report to Congress. None of the comparative analysis, which they were required under the law that I just showed you in the previous slide, none of them have contained sufficient information as required by the laws and the regs. So this is an obstinate bunch of people, and Congress, as a result of them continuing to game the system, is looking in this session at different other ways to force compliance. So let's talk a little bit about those, and then we'll talk about how you might be able to engage on some of these. Next slide. And I promise this is my last slide. So, there's about 4 committees that are the key ones that deal with parity. 5 maybe on the House side, but so we've got the Senate Finance Committee, the Senate Help Committee, which stands for Health, Education, Labor, and Pensions, and one of your senators sits on that committee. We've got Finance Committees considering legislation covering parity. The Senate Help Committee is. We have legislation pending to give DOL the authority to be able to impose fine, not just on not just employers, but to impose it directly on insurance, because their jurisdiction is only on self-funded employer groups. And we're asking, and we're getting some legs on being able to impose fines against the insurance companies themselves. Right now, in order to get the law passed, one of the compromises we had to make was that state and local governmental plans, in other words, like county health plans, they could opt out. We're thinking about repealing that opt-out so that they can't opt out. And then providing grants to states to assist with parity implementation, because what we have found is that the states that hire consultants that teach them how to do compliance audits are the ones where we've gotten the biggest fines and we've made the greatest amount of change. So all this legislation is pending. And right now I don't have bill numbers because they're just talking about including all this in a larger package that will reauthorize SAMHSA, the Substance Abuse and Mental Health Services Administration. But I will pledge to you that I will get, when we have bill numbers, I will get them to Senator Hoffman, and he can make sure that all of you, and I'll give you some tools on how to activate on these issues when they're actually introduced in a bill. So next slide. And that's it. And John, I'll turn it back to you. We can take questions or further discussion, however you like.
I think what I'll do, I got 3 pages of written stuff, Carol and David, to go. David, I guess, first of all, thank you, Carol, for going through there, including some aha moments, 21st Century Cures Act, the GAO report. I think all of us, it would be in our best interest to grab that report and try to pull out of there what's missing, right? And the advocates that we have on our call, all of us, right? We keep saying to ourselves, when's the spotlight going to be turned on this issue, right? And the issue of how the system is not interacting together with one another, right?
Right.
There's a couple of people on this call that, are very, very much have been a huge process in writing legislation this year to really highlight how the Department of Human Services is doing or not doing what they're doing, right? And so what I think I'm going to do, David, and if you want to add something to Carol, is my mind is thinking about, all right, what's next already? But I think in the interest of time at 6:04, I'm okay, David and Carol, to open this up. I mean, we have a small enough group. There's a lot of folks on here that are a wealth of information. Dr. George Lindahl is on here, and David, George, and George is actually on our board. Begin anew. George is absolutely, when it comes to trauma and recovery and mental health, he's it. So I'm glad to see him on here. So I'm going to go ahead, and I think I'm going to do this right, Kevin. If I can't do this, there we go. And we're going to say unmute, right? Can you automatically unmute if you got a question? You want folks to go ahead and feel free to just throw it out there. So
let me say this, John, to you too. Yes, I don't want to say much. I want to hear from everybody, but after this is over, I'm looking forward to connecting with everybody as you saw what Carol laid out, so we can move ahead on these next pieces. So I want to hear from people, but I also want to get ready to gear up and work with you all on this enforcement piece.
And could we do this if folks want to, raise their hand, pop up the hand? I think I did that up. And then we can go in there. And Randy, I want to say thank you for you got your hand up right away, but thanks for your tidbits in there about the HMOs and just how much money they made last year. As Carol was doing her presentation, the timing on that was absolutely perfect. If folks saw that in the chat room, if not, we'll share it with Randy. Talk to us.
Thanks. So Carol I've known Carol for a long time, and she's one of the people that has really mentored me and helped me become the advocate. I am not so much the activist anymore, more the advocate, which sometimes I'm still the activist, which we know is necessary, but I just want to say thank you. And it just really, I put a bunch of stuff in the chat. Of course, I follow as much of the issues as I possibly can, probably more than I'm actually capable of, but that's okay. This is the second call I've been on with Carol today, in fact. But I just wanted to point out the behavioral health. I had that conversation with Senator Hoffman. When did we have that? Back in January, December, when I said I hate the name behavioral health because it implies that I have a bad behavior, right? You're a bad kid. Like we talk about, anyways. So when Carol said that, I just had to laugh. I'm like, oh my God, I've said that so many times. Like, I don't know the right name to come up with, but I dislike behavioral health. But I just threw a bunch of facts or a bunch of stuff in the one that I watched mostly was the United Healthcare. They got fined $15.6 million, whatever they just settled last year. That's a drop in the bucket for a company that's worth $470 billion, right? I mean, that's like me whipping a $20 bill out of my wallet and saying, here you go, thanks. So that's how they got away with getting around the parity laws recently, right? And it just disgusts me. So, but I appreciate you guys, and Dave, by the way, you still owe me coffee. We have to connect. But I just appreciate you guys being here and educating people on this, because I just learned a few things today, but I try to do as much as I can here in Minnesota, but it's great to have you guys come in and help. And so I greatly appreciate it.
So thanks, Randy. And, just Carol and David, is Randy's talking, about those shared stories about how this word doesn't fit where we're going, right? You guys kind of touched base on how this act hasn't lived up to its vision, right? How there's still this stigma that's sitting out there, right? And a couple of things that highlighted, Carol and David, is I'm absolutely sick and tired of the burden of proof that has to go back to the family, or the burden of proof
Exactly.
that goes back to, right. And if you're having state and local regulators that are slow to implement something, how can we as advocates, right? And you had mentioned it, a watchdog thing, right? You also said if we stay silent, that's going to kill us because nothing's going to change, right? And you also bring up the thing that we hear day in and day out, is that the system, right, says, oh, it's so complicated. We got to get this, and and it's going to have to go over here. And, Randy had a bill, and guess what? It had to go to state and local government. There's no way in hell that bill is going to come out of there. So what we did? We just paired it out, and we're trying to match it up with the House on something, right? It's like, so help us. If we're missing something in Minnesota, folks, right? What is it that we need to be thinking of, right? And so, anyway, I threw that out there because those things are highlighted in as we're talking. Anybody?
Has there been a report on the effectiveness of compliance with the parity law in Minnesota?
Yeah, I think. Hey, Jody, you got your hand up. Do you address that? Is that what you wanted to address on?
Not in particular.
No, there is some old reports out there. I don't think we've done it from a GAO report or a legislative auditor report on that.
I would really strongly advise you to do that, as long as it truly is an objective agency that's not politicized. It
is. The legislative auditor in Minnesota is specifically instilled to do legislative audit reports, right? Look at it from an objective viewpoint. We have task force, right? The mental health task force. How many blue ribbon panels and task forces Minnesota put in play? Jody, Randy, in Roy Crane. How many have we put in play, David, in the last, bajillion years? And what has come out of those really? Is it something desirable that we should be doing? I don't know. I mean, so thoughts?
This is Jody with Wellness in the Woods. One of the pieces that, this is obviously at this point out of my scopes. Maybe someday when I retire, and I'm not spending every waking minute keeping 45 people employed. But one of my frustrations is that we as advocates are still jumping on each other and can't work together to make things happen. It's like, well, he has and she has, and what if I don't get? And we're not going to run out of people who need support. That's a real frustration for me. And I've been doing this kind of work for, I don't know, almost 40 years. And the reality is there's still this conversation between rural and metro, substance use and mental health, who has more or best or worse, and it's really hard that we just can't come together to make these things happen. And the other thing is, most of us who are doing the programming work, who are out in the field, it's good that we have people like you, Carol, who can let us know what's going on. Because honestly, I don't have time to do this. So for you to come forward and let us know what's going on and what we can do, even the idea of just putting that on a signature line, that's really simple. That's
it is.
I can make time to do.
Jody, thank you for your comment. One thing I want to say, and one thing I learned on this parity fight, Carol will remember this, is same thing happened. We had the addiction community, the mental health community.
And mental health. Oh yeah, it was terrible.
Community out. And I remember early on, I was shocked. And what the lesson I didn't know was they said, that's what your dad fought for, is to keep everybody together. So to your point, we're a relative, we cannot fight each other. We have to be unified across all, across all disciplines, because my dad used to use this term, a besieged minority. That's what we are. And so we need the powers and numbers. And so what you said is critical. And it was critical in this parity battle where we really had to say, no, we're not going to leave the addiction folks behind. And so
Right.
it was, and frankly, I would say the addiction folks are the ones who stepped up the hardest from a grassroots perspective to get Parity passed.
Yeah.
Thank you.
I think that unity is key to winning big battles. And that doesn't mean that you agree with all of your partners and allied organizations on everything they do. And in fact, I mean, but you've got to build a unified coalition. And it can be just on one or two things. And then you have to mind your own business about everything else that any of your other allied partners are doing. But agree on one or two key things and agree to work on that. And then when one of your colleagues or somebody goes, well, but so-and-so did such and such, you have to go, no, so-and-so, what we're here to talk about today is getting parity enforced. Minnesota was one of the first states to pass a parity law, a state parity law. And yes, it's sunset and there were complicated things about a lawsuit, but, you know, Minnesota is the land where, you know, addiction and mental health stuff like really got cranked up. And it's like, if your state's not enforcing this law, it's almost not being true to its heritage. I mean, you know, the nickname in Washington for Minnesota in our policy circles was the land of 10,000 lakes and 10,000 treatment centers.
Ah,
Not anymore, but in the old days, I'm showing my age, but yeah. So it's like, you guys can do this. And I will tell you what I have found is, I feel like a lot of times people in our field, and I'm speaking broadly here of addiction and mental health, we somehow inhale the pathology of the illnesses and then turn it inward on each other. And we have to stop doing that. And I know it's easier said than done, but this is a principled coalition effort. It's not a personality driven one. And it's not who got how much, because every taxpayer is being robbed here by insurance companies, and they're letting their families and loved ones go down the damn drain. So you have to be mission oriented. And I know it's a lot easier for me to stand up here and proselytize. I will tell you honestly, the way the addiction and mental health group started working together in Washington in the 90s is because Patrick Kennedy came in there and basically blew our heads off and said, you will work together or I will not carry this bill for you.
wow, I love that. The little bully pulpit there from Patrick. That's good.
Yeah.
So Carol, David, and team, we're going to go. Retha has got her hand up. We'll go Retha, then we'll go Kelly. And I just want to say one thing. George Lindahl, you heard the thing about staying in your lane, I think, on that. That was the theme on there, wasn't it? No? What can I control? What the things I can control, the stuff I can. But Retha, go ahead.
Yes, thank you very much. I wanted to say to David, I worked on your father's early campaigns, and the thing that I always hear in my head is we always do better when we all do better. We all do better when we all do better. And that you can put that anywhere. You can put that in the grocery store. You can put it in mental health, in treatment centers, wherever. We all do better when we all do better. And I'm a woman in long-term recovery. I got sober in 1978. Thank you, Randy. Things have changed a lot, and language has changed, and the changing of the language is what kind of pulled me into, let me become more of an advocate. I have done my advocacy in 12-step rooms, and I've worked with hundreds of women, maybe thousands, I don't know. But the reality is, in my opinion, and we talk about this quite a lot, I really don't know too many people in addiction who don't also have mental health issues. I just think that's where it's at, and we may not want to recognize that. But for me personally, I tried committing suicide when I was 12 years old. I used from the time I was 13 until I was 29. Me too. When I finally got to the rooms, I knew that there was something wrong with my thinking, and it wasn't, and I knew that I was using chemicals and alcohol to try to unscramble my brains, which obviously it didn't work. But what worked is getting into a program, into working with others, helping others, bringing others along. And that's the thing that we have to do. We have to bring each other along. As Ram Dass would say, we are just walking each other home. Thank you.
Thank you.
Thank you.
Thanks, Retha. Thank you. Absolutely. I'm glad you're here tonight as well. Kelly
Thank you.
Waller. Kelly.
Hi, everybody. I just wanted to just make a comment. There's a few things that were eye openers for myself, but the stigma, as I joined this world of SUD, there's been a lot of talk about stigma, but not in the context of which I heard here today, meaning you'd always hear about rhetoric. Oh, you better, word choices matter, which is correct. But I think what you've shown today is it's so much bigger.
Mhm.
A few words. Maybe we can get a quote to put on our signature line so that we're united in that delivery, or whatever, it's correct, a correct quote. I guess it was really eye-opening as far as the insurance companies go. And as we start billing for people and advocating for people in that line, instead of just rolling over to say, oh, well, I guess you can't do X, Y, and Z because, well, now we know we can yell a little louder and turn for some help to get some billings accounted for. So I just thought it was all really eye-opening. Thank you.
And for those of you who are billers, sorry to interject here, but there is a toolkit, and the legislation part of it is a bit out of date. But if you go to parityispersonal.org, there's a toolkit, and it even has some sample letters on how to appeal denied claims. And it really walks through, some of it is complicated, but at the beginning, the part for consumers that teaches you how to do appeals and what to appeal and how to appeal. I think this might be helpful for some of you who are billers, so that when you come upon a denial, like one tip I always tell my clients is, if you are on the phone with an insurance company and their UR person is saying, we can't cover this because of this, that, and the other thing. If it's one of these things that you see that I've put in here, like if it's prior authorization or medical necessity criteria, if you tell them that you believe that the action they are taking is a violation of the Mental Health Parity and Addiction Equity Act, I guarantee you will get bumped up another level. I'm not saying you'll get your claim paid necessarily, but you will definitely not get with the clerk whose job is to say deny, 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 deny. So just saying that you think that this is a violation of this law, it will signal to that they need to bump this upstairs to their manager. And sometimes that can help. So just a little tip there.
Thank you for that.
Thank you. That's huge.
Yeah.
And I'm sure there's a lot of people who don't realize that.
That's exactly right. And don't be worried that, well, I'm not sure it is or it isn't. I can tell you, if it's one of these non-quantitative treatment limitations, they do not enforce them the same. And we're trying to push back and make it incumbent upon them to prove that they are in compliance, not to have a layperson have to cite studies out of JAMA to show that this appeal is worthwhile. Put the onus back on the insurance company to prove that they are lawful. So don't get hung up. Well, I don't know if this is really unlawful or not. Tell them it is.
You absolutely get onto something, that there's that regulatory piece. I'm going to be compliance of this regulatory piece, right? And we always say that. Take Public Law 94-142. It's the education of all handicapped children, right? The burden of proof still falls on the parent, but there's a due process element in there.
That's right.
That has to come back, and it's like, all right. So where's this other missing piece here? So this has been really fruitful. I know we're getting at 6:23. Randy, you gotta, everybody doing okay on time? 6:30 we're going till, but I just wanted to say this has been really fruitful, and there's going to be some follow-up, Carol and David, that I think has enhanced this, and I appreciate you guys for doing that. Mr. Anderson, multitasker.
It just helps to have all my screens sitting. You know, I have this command center in my basement, so it's like I've lived here for 2 years now. You know, like my wife thinks sometimes I probably sleep here at this desk too. But it reminded me of when we were talking earlier too, and you just said it. When I was a counselor in a high intensity residential SUD treatment program, and I was just every few days I'd have to get a new auth for these guys. They were assessed at an ASAM 3.1, a high intensity level, and Medica or United Health Group, who administered Medica's plan here in Minnesota, I'd get 3 days. And I'm like, and it'd be a Friday. And I would say to them, so I have to call you back Monday again to get another. And they're like, yep. And and then we wonder why our outcomes are so horrible, because I'm spending so much time on the phone, faxing treatment plans and justifying why I need 7, 10 days, 2 weeks, whatever and they're going to, we'll give you 3 days. I'm like, that's useless. I mean, thank you, but it's useless. And so, I now that I've done this work, the advocacy work, I understand, and I read a book called Delay, Deny, Defend by an insurance adjuster once. Opened my eyes. But anyways, when you guys were talking about that, and I would talk to our DHS people all the time in our alcohol and drug division and say, well, how do you expect us as counselors to have better outcomes and spend more time with our patients or clients if we're constantly fighting the insurance company for a few days to get someone care, right? I mean, it's horrible.
They're putting the onus on you as a counselor to go dig up a bunch of studies to defend your appeal. Like you're going to have time to do that? Appeals without the evidence don't win.
David.
Well, yes, indeed. Like I said, I'm just to be a part of this group I'm pretty honored to be here tonight, John. I really appreciate you pulling this together. Carol, you and I worked a long time on the bill. I've been doing other things, but I will commit to everybody here. I want to work with you let's finish this off. Let's lead again legislatively together in Minnesota. We know what we've got to do. We can do it together, organized together. We will stay on top of it. When it comes to parity denials, talk to me, because I don't know, Carol, what you think, but I have a strong voice still when I do make calls, and I'm willing to do that. And so let's use this. You brought us together. Let's use this as a jumping off to really get going here in this state on this, putting the teeth into this bill that we worked hard to pass. And let's do this.
And if y'all form a coalition, I will help. I will give some of my time to help move this along, but you all have to decide what the most important issues you want to work on them, and then work on them together, but like laser like. And I think you're going to have to get some data to show that the law is not being complied with in your state. And you can get that in a number of different ways. But I also think you have to empower individuals and families on how to appeal and how to complain.
Yep.
Don't just take no for an answer. They're banking on that.
Well, I just feel lucky in Minnesota. I mean, I obviously work with people all across the United States, and I hear the stories from my partners in Pennsylvania or Texas, or I'm like, oh my God, I'm so glad I live in Minnesota, like sometimes, because those stories are 10 times worse than my stories, right? So.
Well, good. I mean, and again, I don't want to tell you have a problem if you don't, but I would say I would get some data from the State Department responsible for looking at this to see exactly what's going on.
Sounds like you just gave my legislative assistant another thing to look forward to, Kevin. Usually he would chime in and say, yeah, great, you just put in there. But seriously, Carol, I think you've embarked. It's asking the questions, right? We're asking the questions, and the answers might be out there. We just don't know. If Randy and Cherie and Ruth and Rachel and Melissa and Roy and Retha and Tom and Jody and don't have the answers, right? They're not there. maybe they've never been published. We don't know, right? But you're asking that question, right? We're asking that question. So
Another strategy, John, I was thinking about that might work is we've seen in other states where a local law school who has, students that are specializing in insurance law,
Yep.
you can engage them to help with doing appeals for people, maybe, once a month on a Saturday or something,
Yep.
to show people, and they will file the appeals for them. And it's a win-win because the students need the experience and the consumers need the help.
Wow. Good to know. Another thing. So I'm ready to start this coalition. You guys ready? You want to do this? So yeah, Randy, thumbs up. We're good. David, thumbs up.
I need to belong to another coalition, right, John? or Carol, right?
We got Frogtown. I got the Frogtown. I got the Frogtown leader right there. We're good to go. Miss Lima, you ready? It's 6:29, and I just want to say to you two, thank you for taking us down this history, this lane about how we got to where we are and what we really need to be doing going forward. Because like you said, this it's not lived up to the vision that was set up, right? There's still some system stuff. We need to, really face those system stuff, head on and say, what are we going to do about this? But do it in that's a strategic way. And I love the fact, I don't know, my legislative background, I find ways to get stuff passed. Carol, I don't know, lots of bills, lots and lots and lots, and I move them. And I always talk about finding different vehicles because you can attack. And you just validated why we should never stop fighting when you said on a bill that was, meant to, be an economic bolster bill, right? You attached this in there and it was there. It's like,
because we had so many co-sponsors, they knew that the support for Parity was going to push that banking.
That was strategically absolutely fantabulous. It was really good, and so
hold on. Why are you saying that to Carol as if that was her idea to get that done here?
Senator Dodd
joking.
and Dave Wellstone did it. Yep.
David, you don't.
I'm saying it's brilliant. It's like, look at this. I love this. Okay, David, this is now about you. That's your codependency coming in. So, it's like, I love you for that. So I'm supposed to be funny. That was supposed to be funny.
Yeah.
Not being funny.
Well, the funniest thing was, thank God for Harry Reid.
Yeah.
For somebody. And
story.
the last thing I'll tell you on that is Harry Reid felt the pressure because we said you made a promise. And I looked at him and said, you made a promise. That's what we all have to do here to the politicians in Minnesota. You got to do this. We're going to put your feet to the fire and we're going to make you deliver. And so that was the lesson there, really. And that's why Harry stood up.
Yeah.
You're spot on, David. And it's absolutely brilliant strategy work that you guys did putting this together. So, and the lessons learned and going forward. So, thank you. It's 6:31, just like I said in Facebook. I want to thank you two for taking your time. I want to thank everybody for taking an hour and a half out of their daily life. I mean, was it good? You guys, get some feedback to me. If you want to do something different, we'll go that. But I want to go to the next. I want to take the next step with this. So I thank you two very much, and have a super.
And you can name the legislation after Jim Ramstad.
Oh yeah, we got some rammer. I got some rammer stuff in here. So thanks.
Yeah.
Amazing.
Thank you, everybody.
We have a post office named after him now. So why not?
Right.
Well,
Randy?
you could put a Democrat's name on it too and make it bipartisan, but it was part of the secret sauce of us getting this done.
I love it.
Naming it after somebody that everybody loved,
I love it. This has been good. Thank you,
Yeah.
everybody.
Night,
Okay, bye.
Everybody.
Bye.
Thank
Bye.
you.
Thanks.
You.